My name is Muhammad Shamil bin Muhammad Adlan, metric number 215938, and I will be explaining on the history behind Alkaptonuria. So, the word Alkaptonuria originates from the Arabic word alkali, and the earliest evidence of this disease was found within the cartilage of the Egyptian mummy Harwa, dated back in 1500 BC. However, the term Alkaptonuria was first officially used in the year 1859 in a female patient who had homogentistic acid in her urine. In 1890, the English physician Archibald Garrett examined the yellow-brownish urine of a 3-month-old boy who was diagnosed with Alkaptonuria. With the technology back then, it was first assumed that the disease was caused by bacterial bowel infection. However, Garrett then found out that the boy's parents were cousins, and after examining several other patients with Alkaptonuria, Garrett proposed that the hypothesis of Alkaptonuria being an inherited metabolic disease in the year 1902. His article on Alkaptonuria was first published in the year 1908 to The Lancet. And Alkaptonuria is considered to be the disorder that is responsible for the creation and evolution of the inherited metabolic disease branch of medicine that we know today.
My name is Aziz bin Hasim and my matrix number is 214987. I will explain about the cause of Alkaptonuria. Alkaptonuria is caused by the mutation in the homogenticid 1,2-dioxygenase, or we call it as HGD genes. It is an autosomal recessive condition. Basically, autosomal recessive condition occurs when the two abnormal genes are inherited one from each parent, which this means that both parents must carry the defective gene and transmit the gene to the child for the child to have the condition. The mutation of HGD genes will cause to the deficiency of the HGD enzyme. HGD enzyme expressed in various tissues such as kidney, liver, and small intestines, and this will lead to the accumulation of homogentic acid in connective tissues, and last it will cause the ochronosis.
Hi, I'm Muhammad Akademia bin Ghazali, metric number 21406, and now we'll be looking into the mechanism on how the mutation in HGD gene causes Alkaptonuria. Alkaptonuria, the enzyme HGD cannot form formaldehyde acetoacetate from homogentic acid, or HGA. Therefore, the level of HGA in the blood will rise 100 times than normal, even though the kidneys have eliminated a plentiful amount of HGA. HGA is a reducing agent, and especially under alkaline conditions, it is rapidly oxidized to form benzoquinone acetic acid, or BQA. And this BQA produces polymers that match the skin pigment melanin, turning solutions and tissues black. This accumulation and deposition of BQA in the collagen is called ochronosis. The ochronotic pigment deposits bind to the connective tissues of various organs, leading to the destruction of joints, valves, and also the intima layer of vessels. Also, the presence of HGA in the urine leads to the characteristic of darkening upon exposure to air.
Assalamualaikum and hello. My name is Irfan Hilmi bin Abu Hassan. My metric number is 213948. Now we move on to the next part, which is part 4, sign and symptoms of Alkaptonuria. The first sign or symptom that can be seen is the dark urine. So it is one of the first and the prominent symptom that we can detect. So the dark urine is due to the oxidation of homogentic acid. This oxidized and polymerized homogentic acid accumulate throughout the body, especially in the fibrous and cartilaginous tissue, may result in the bluish-black discoloration of connective tissue known as the ochronosis. Most of the noticeable in the cartilage, sclera of the eyes, and the skin, particularly in the place exposed to the sunlight or pressure. The third one is the enteropathy. So enteropathy is the joint condition affecting the spine and major joints such as the hips, knees, and shoulders. This typically develops in the third or fourth decades of life and may result in persistent discomfort and limited movement. So other than that, accumulation of homogentic acid can have an impact on the cardiovascular system, potentially leading to calcification and stenosis, also known as the narrowing of the value between the two left heart chambers. So this stenosis can block the circulation of the blood to flow into the left heart chambers. Apart from that, the excess homogentic acid can lead to the formation of kidney stones and the stone in the prostate. And this can be identified by using the ultrasonography and the helical abdominal CT scan. The last symptom is the skin pigmentation. This is similar to the achronosis. As individual with alkaptonuria age, the accumulated pigment can become visible in the skin. It gives the skin a characteristic of blue-black or grey-brown appearance. That's all from me. Thank you.
Now, me, Muhammad Alfian bin Serisi, with metric number 215587, will explain to you about current treatment available for Alkaptonuria. From what I've been studied through articles, there is no specific treatment for Alkaptonuria. However, there is an alternative to cool down this rare disease. The first one is symptom management. Individuals with Alkaptonuria may experience joint pain due to arthritis caused by the accumulation of homogenous acid. So, relieving the pain by taking anti-inflammatory medications or narcotics, discomfort and pain can be reduced. Physical therapy also can manage the symptom by maintaining the flexibility, strength, and mobility in muscles and joints, then potentially slowing down the progression of joint problems. It is also advisable for individuals with alkaptonuria to avoid activities that put excessive strain on their joints to prevent further damage. The second one is complication prevention. Regular monitoring of heart health is essential due to the risk of heart valve disorders caused by the accumulation of homogenous acid. In severe cases, surgical intervention to replace damaged heart valves may be necessary. Some individuals with alkaptonuria may develop kidney stones or prostate stones, so treatment options include surgery or other therapies also needed to address these complications. Routine checkups and monitoring are also crucial to detect and address potential complications. The last one is investigational treatments, which is nitisinone. Nitisinone is a medication that has shown promise in reducing levels of homogenous acid. This treatment will be explained furthermore by my member. That's all from me. Thank you.
Disease, disease-specific research. So there are various studies that have been done on alkaptonuria, but we will focus on just a few. So first, genetic studies. Genetics of alkaptonuria. Alkaptonuria is an autosomal recessive genetic disorder caused by mutation in the HDD gene, which includes the enzyme homogentisate 1,2-dioxygenase HDD. HGD is responsible for the breakdown of homogentic acid HGA, the toxic metabolite that accumulate in the acute patient. Mutation in the HGD gene lead to deficiency of HGD enzyme activity, resulting in the build-up of HGA and the development of achronosis. Next, therapeutic approach. Nitisinone as a disease-modifying treatment. Nitisinone is a drug that inhibits the enzyme 4-hydroxyphenylpyruvate dioxygenase, which upstream of the defective HGD enzyme in alkaptonuria. Clinical trials have shown that nitisinone can effectively lower level of homogenous acid HGA, the toxic metabolite that causes the symptom of alkaptonuria. Nitisinone has been approved as the treatment for alkaptonuria in Europe, making it the first effective treatment for the rare disease, but it will not completely cure the disease.